The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Hello everyone, good evening. Welcome to yet another episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. I am Jessila Mujib, your host for today. PRP or platelet-rich plasma injections are gaining popularity in a variety of conditions from sports medicine to hair fall treatment. So what is PRP? To speak about this subject in detail, we have with us Dr. Archana Elizabeth from Al Hilal Hospital, Muharraq. She is a consultant in dermatology with an experience of over 16 years. So let's welcome Doctor to the show and move on to the topic. So Doctor, welcome to the show. Thank you for joining us today to discuss this
Thank you for
wide
having
subject,
me here.
PRP.
Yeah.
So Doctor, we usually hear about PRP for hair, PRP for face and skin and all. So what is PRP? Please explain for our viewers in detail.
Yeah. PRP is a therapy which is produced from patient's own blood, which is made up of plasma and highly concentrated platelets. So what is plasma? Plasma is a portion of blood which contains RBCs that carries oxygen, then WBCs, the immune cells, and the platelets responsible for coagulation. So these platelets contain a lot of growth factors, cytokines and proteins. So the percentage of the components in the normal blood is RBCs is about 93% and platelets is 6% and WBC 1%. So in PRP, the concentration of platelets will be increased. That means it will come up to 95% and RBCs will be around only 6%. So these activated or concentrated platelets are injected into the desired sites to enhance the body's natural healing process. So this is the base of PRP.
Okay, doctor, what is the role of PRP in dermatology these days?
Yeah.
So can you please explain for us?
Yeah. So in recent years, the importance and demand for PRP in dermatology and cosmetology has been increased, as it is proved that it has the ability to produce new cell growth in skin, so which reduces or retards the aging process. So the aging skin that has been exposed to chemicals, pollutants and ultraviolet radiations will lose its property to produce collagen, elastin and hyaluronic acid. So this results in wrinkling, sagging and skin falls and dehydration of the skin. So when the rich platelets are being injected, so it produces a lot of growth factors, so which produces the collagenization or stimulates the collagenization or elastin production, which results in a younger and hydrated skin.
So mainly it is used for beauty purposes.
Yeah, cosmetology, that is, yeah, mainly used for yani skin rejuvenation.
Okay. So doctor, what are the conditions in which PRP is applied for? We would like to know that.
Yeah, as you said, it is wide variety of conditions, like from sports medicine to cosmetology. It is used in ligament, muscle and tendon injuries to fasten the healing and to alleviate the pain. It is also used in post-surgical healing process and in skin rejuvenation. And PRP also used in skin rejuvenation, reduce wrinkles, acne scars, pigmentation, all that. And as you all know, it is used in the hair restoration therapies also, like it can be used almost all types of hair fall. So these are all the main indications.
Okay. Doctor, can you explain what are the steps involved in PRP?
Yeah.
We would like to know more about the steps involved in PRP now.
Steps. So normally it is a very a relative a simple procedure which can be done in 1 to 2 hours in OPD base. No need of hospitalization. So the step involves like the collection of blood from patient. Almost 10 to 15 ml is collected and kept in a centrifuge for centrifuging. A centrifuge is a machine that spins at a high speed. So a standard rate and rotation is kept for the centrifuging. Okay, so this process physically separates the plasma, RBCs and the platelets. So that regular blood volume contains almost about 2 lakhs platelets per milliliter. But here it is increased up to 5 folds than this amount. So once this process is done, the rich plasma is being extracted in a syringe and administered immediately to the desired sites.
Now this is the
Steps, main steps involved.
Okay, doctor, how many sessions one should go for in PRP?
So for hair restoration, normally the patient have to go. Normally in hair restoration, it depends on their degree of hair fall. So this patient have to go 4 to 6 sessions once in a month. And once this initial treatment is over, then they can have sessions per 1 to 2 sessions in a year or 6 to 8 months according to their requirements as a maintenance.
Okay, usually we say PRP for hair.
Yeah.
So how effective is it for hair growth?
Yeah, as we discussed earlier, it is used in almost all conditions of hair fall. That is male and female pattern of baldness, telogen effluvium, which is caused from stress and any recent infections, and alopecia areata, that is a patchy loss of hair. So here normally we give intralesional steroids. So the patients, those who don't want to undergo steroid injections, PRP is an alternative. So PRP is also helpful in scarring type of alopecia as it improves the fibrosis. So it is also used in the hair transplantation surgeries. After hair transplantation surgeries, as it strengthens the existing follicles and also the new donor graft. Here also the mechanism is almost same. So the rich plasma which are injected to the scalp will release a lot of growth factors, and which improves the or which increases the blood flow to the follicles, hair follicles, reducing the destruction of the hair follicles, and in turn prolongs the growth phase. So that result in the dense and thicker hair.
What are the contraindications of PRP? I mean, in what all conditions we should not go for PRP?
There are few conditions like that which we don't suggest PRP. Few of them are acute infectious diseases, then patients have history of cancer, then patients having low hemoglobin level and low blood volume, and patients on blood thinners, and even pregnancy we don't suggest PRP.
So, doctor, how do we know that a patient has low hemoglobin? Should we go for blood test before PRP?
It's better that investigate the patient just before the procedure and confirm that they have a good volume of blood. That so when the procedure is done, they will be benefited from that.
Okay, doctor. So PRP is gaining much popularity now. So what are the advances in PRP these days?
Yeah, as you know, there is a lot of studies are going on in this field. One new treatment is that the use of GFC, that is the growth factor concentrate. So here the growth factors alone are extracted, not the platelets. Growth factors are extracted through special methods and kits, and is being injected to the desired sites. And almost for all these indications it is used. And another therapy is like you can combine PRP with the other products, like you combine PRP with hyaluronic acid to boost up the skin rejuvenation or hydration of the skin. And in the same way can be combined with biotin and other injectable vitamins for the hair restoration therapies.
Doctor, any side effects are there for?
So the side effects almost are, because it's a very low risky procedure, as the product is made from the patient and it is going into the patient. So the allergic reaction is very minimal. So sometimes patient can have irritation or pain or mild swelling at the injection site, which will be normally resolved by 12 to 48 hours, 24 to 48 hours, it will be resolved.
Okay. So when we compare Botox and PRP, what do you think? Which is more effective?
Yeah, both are effective in treatment of anti-aging treatment, but both works in different ways. PRP helps in natural way of production of collagen, whereas Botox freezes the muscle that causes wrinkling and sagging. So the choice between PRP and Botox is always depending on patient's needs and preferences. So those who want to have a natural and a gradual improvement in their skin texture, they can go for PRP, but those who want an immediate result can opt for Botox. In either conditions, it is important to take the advice of a qualified medical professional to decide which is the best option for them.
So, Doctor, any takeaway message for our viewers from your side?
It is a very effective and less risky procedure, as it comes from you and goes to you. As Hippocrates said, the natural healing force within each of us is the greatest force in getting well.
Thank you, Doctor. Thank you for being with us and giving us a detailed information about PRP. Thank you once again.
If you have any queries regarding PRP therapy, please do visit our center in Moharak. We'll be there to help you.
So, viewers, I hope you got all the required information about PRP. Meet you all in yet another episode of Bmc Global Live Al Hilal Health World, Nothing But Lifestyle. This is Jessila Mujib signing off. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.